Hey, welcome. Today we're going to talk about something that affects millions of people: clinical anxiety and panic attacks. We're going to break down what they are, how they're different from just, everyday stress, and look at the path to finding that sense of calm again.
This quote right here, I think it hits home for a lot of people. It says these conditions can feel overwhelming, and that's so true. They can completely reshape how you think, how you feel, and even how you connect with the people around you.
All right, let's dive right in. First up, beyond everyday nerves. So what actually makes clinical anxiety different from the normal jitters we all get sometimes? So here's the key difference. We're not talking about just getting nervous before a big presentation. Clinical anxiety, well, it's a condition where you're dealing with this constant tension, this unease, and even physical symptoms that can really get in the way of your day-to-day life.
This chart really lays it out perfectly, doesn't it? Those everyday nerves, they're temporary, tied to a specific situation. But clinical anxiety, that's a whole different beast. It's this persistent tension that can stick around for months, and it starts to dictate your choices, maybe even shrink your world a little bit.
And this is so important to get. This is not a personal failing. It's not something you just get over. As you can see, the roots can be in our genetics, past trauma that hasn't been resolved, or even just long-term stress or other health issues. It's a really complex mix of things.
Okay, so that brings us to our next section, signs it's time for help. This is all about learning to recognize the signals your mind and body are sending you.
So when does it cross that line? When is it time to maybe think about getting some support? Well, some key things to look out for are worry that just doesn't let up for weeks or months, having panic attacks, or just living in fear of the next one, finding yourself avoiding social situations, or maybe you're having trouble sleeping or concentrating. Even physical stuff, like a tight chest or shaking that's tied to that feeling of fear.
And that's exactly why paying attention to those signs is so crucial. The thing is, anxiety rarely just fades away by itself. Catching it and addressing it early on, that makes treatment so much more effective.
And that brings us to a really hopeful part of this whole conversation, how treatment works. The goal here is to pull back the curtain on the process and show that there's a clear, structured path to feeling better.
So what does that path even look like? Well, it usually starts with an initial consultation. This is where you just have a detailed chat about your symptoms, your history, your lifestyle, the whole picture. From there, a plan is created that's personalized just for you. And it's not a one-and-done kind of thing. There's ongoing support with regular follow-ups to make sure the plan is still working for you as you make progress. And that personalized plan? It's really holistic. It can include things like therapy, CBT is a common one for challenging anxious thought patterns. Medication might be an option, but it's definitely not for everyone. The plan often includes lifestyle support too, guidance on sleep, nutrition, getting active, and sometimes it even involves family counseling to help your loved ones understand what's going on.
All right, now let's get into some of the questions that might be floating around in your head. In this next section, Your Questions Answered, we're going to tackle some of the most common worries people have when they think about getting help.
First up, this is a big one, a question a lot of people have. Are panic attacks actually harmful to your body?
And the answer here is really reassuring. While they are absolutely terrifying, no question about it, they are not life-threatening. The most important thing to know is that treatment is incredibly good at making them happen less often and making them less intense when they do.
Okay, next common question. Is medication the only way to go? Am I going to have to take something? And the answer is a clear not always. So many people respond really well to therapy all by itself. Medication is an option, for sure, especially if symptoms are severe or just won't let up, but it is not the default. It all goes back to that personalized plan we were just talking about.
And finally, this is a really important one, especially when you're thinking about taking that first step. Is this whole process confidential?
Yes, 100%. Confidentiality isn't just a suggestion. It is a cornerstone of psychiatric care. Your records, your conversations, it all stays private. It has to, right? That's how you build trust and create a safe space where the real work can happen.
So, after all of this, where does it lead? Well, it leads to our final section, finding calm again. Because at the end of the day, the whole point is to reclaim your peace of mind.
And if there's one thing to take away from our conversation today, it's this: anxiety and panic attacks are treatable with the right support. This is not a life sentence. These are manageable conditions.
And this is what success looks like. The real goal is to get back that sense of calm, that confidence, and that feeling of control over your own life. It's really just about getting back to feeling like you again. So, we'll leave you with this question to think about. What could your first step toward peace of mind be?
Thanks so much for joining us.